Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Good morning or good afternoon, wherever you might be. Thank you for joining us for this live webinar. My name is Molly Casey, and I'm on the marketing team at Axxess. Today, we will hear from two home healthcare industry experts who will share best practices to solve healthcare staffing challenges using technology in an ever-changing post-acute landscape. Before we get started, let me tell you a little bit about Axxess. We are a leading home healthcare technology company offering a complete suite of easy-to-use, innovative software solutions, empowering home health, home care, and hospice providers to grow their business while making lives better. I'm looking forward to today's presentation as it's very timely. Joining us are Tammy Ross and Arlene Maxim. Tammy leads Axxess's professional services team. She has over 30 years of experience in home health care and is a sought-after thought leader and with operational and clinical excellence in her toolkit. Joining her is Arlene Maxim. With many years of nursing experience, Arlene Maxim previously co-founded a regional multi-million-dollar Medicare certified home health care company, hospital-based home care and hospice companies, as well as transitional care programs. In her role as clinical consultant with Axxess, she applies her extensive knowledge and expertise to her speaking opportunities, training, and consulting with clients. Before we get started, just a couple of housekeeping items. Everyone's phones are on mute. However, you may submit questions throughout the webinar. If time permits, we will answer as many questions as possible at the end of the webinar. If we don't have time to answer your question, we will follow up with you after the webinar. And then following the webinar, we will provide everyone with a link to the slides and post a video recording of the webinar on our website, axxess.com. If you would like to access the slides now, you can get them right within the webinar interface. You'll see over on the side, there is a link for handouts, and there you'll see the slides. So we will get started, and I will hand it over to you, Arlene and Tammy. Thanks for joining us today.
Well, thank you, Molly, and welcome everyone to our session on healthcare staffing challenges. And I'm so happy to bring this to you today because what I'm hearing from everyone around the United States is that they've got a terrible shortage of staff. And I think by the end of today, by the end of Tammy's presentation, for sure, you're going to understand how Axxess is able to help you with those staffing challenges. Understanding right now we've got a silver tsunami going on, and we're going to talk about that a little bit in some detail. And we have some other challenges that have created a perfect storm for managing home care agencies. We have nurses who are retiring, nurses who are just getting out of the field, and is creating a problem that we knew was coming, but we weren't really prepared for it. And certainly COVID-19 has not helped with that. We're going to learn how to motivate your healthcare force in a remote care world to get ready for things that are happening now and things that are happening in the future. And we're going to talk about some technology trends that are going on and some technology enhancements. They're going to help you grow your referral base and also grow your revenue. Okay, so there are 1 in 5 Americans that are going to be seniors by 2030. That's just an amazing number. So 20% of the people that we see every day are going to be turning into a Medicare age. And many of those are nurses. 88.5 million people are going to be 65 and older, which is going to give by 2060, which is going to give us an opportunity to see most of these people in home health care. As we found, as COVID has emerged, we found that the hospital is probably not a place you want to be. That's a place where you're probably going to get an infection, and people are looking more and more and more at just staying home and being cared for at home. So with that, all of that, we're anticipating that the healthcare expenditure is going to be $4 trillion by in 2020 already. So we've got a problem with financing all of this care already this year. This is a graphic that shows you, this is pretty incredible, that shows you the thousands of aging population through the year 2050, which is one of the problems that we're having, again, not only with the patients that we serve, but as we look into this, we have staffing issues related to the patients that we're actually going to care for. So the average nurse right now is over 50 years old. That's quite amazing. It's estimated that 70,000 nurses are going to retire annually. That doesn't even take into consideration the home health aides and the aides in general that are helping us as nurses take care of patients in the home and in the hospitals. But 70,000 people leaving the workforce every year and not having that same number coming into the workforce is going to be a problem. We need to keep up with the aging population, and the nurses are more interested than ever now, the nurses that are coming in the field now, in using smart technology. And Axxess certainly has the technology that's going to help support that in the home care industry. So the technology is going to enhance your bedside time and not necessarily spending a lot of time on the screen at the bedside. However, I have to tell you that I feel that we need to use point of care systems more than we have in the past. And if you need some help with that, I'm sure Axxess staff are going to be able to help you. But the point of care system is certainly going to relieve the time that nurses spend in the evening at home. So the average tenure right now of a home health nurse is only 19 months. And that's a problem because with having nurses turning over that quickly, we have a cost associated with that. So the cost is between $37,000 and $58,000 to actually have the turnover occur. And so you're going to have issues with orientation, the cost it takes for orientation, the cost for just personnel issues in general. And this certainly is something that has to be considered when doing budgeting in home health. So again, this is some occupation projections, and you can see here that nursing seems to be one of the largest of the group of healthcare professionals that are going to be needed, that are also looking to take on new jobs. And look at the percent, there's a very high percent of nurses that are leaving the workforce or turning over in the workforce every year. So here we're looking at the numbers of the largest share of the American workforce in general, and the post-acute nurses are no exception to this. So 35% of millennials would be the largest piece here as for supplying staffing, and those are folks that are between that were born in 1981 through 1996. The 2% traditionalists, those are mostly retired now, and they're probably patients of ours right now. 34% are Gen Xers, and those are folks that were born between 1965 and 1980. And then the 29% are the baby boomers. And that's where we expect to see most of the nurses with that 29% that will be leaving in the next several years. So what's causing the turnover that we're experiencing? So some of the things that the nurses are complaining about, and we see every single day, is an increased workload. Particularly now with COVID, we have not only an increased patient load, but we also have increases in demands with types of patients that we're seeing in the home and the types of requirements that are occurring in the home. Documentation has certainly been a pain point for everybody ever since I've started working in home health care. There's a surge in workload. We have an issue with driving time. And sometimes it can be helpful if human resources takes a look at all of this individually with nurses to see if they can possibly help out with arranging schedules. Some nurses, when they come into home health care, have a difficult time working independently and working to arrange their day to be productive. The use of administrative costs to cover visits. I've talked to several supervisors, or particularly right now, are having problems because staff are either getting ill or they're reducing the time they're spending in the workforce, and they're having to take on a lot of duties that the staff members would typically take on themselves. So the managers are getting burned out. Other things that are more personal is fatigue. They're just tired out. Of course, the time in driving, and then developing a work-life balance. And so some of the studies have suggested that the work-life balance is one of the biggest things that we can work on with our staff members to help them understand how they need to relieve some of the stress that they're feeling as they're working particularly during this time. So some of the things that we've heard from nurses ourselves is the length of the paperwork. Well, now most agencies now are using point of care systems, excuse me, and Axxess is certainly one that relieves a lot of that responsibility. But again, nurses really need to start getting back to the point of care documentation so that they don't have so many pieces of documentation or entries into the computer to do after they leave their time of seeing patients during the day. Orientation is inadequate. This has been a problem primarily since the year 2000, since we started with OASIS and we started with the PPS payment system. The many agencies reduce their orientation time with staff because it was a cost that some owners felt was unnecessary. And so orientation sometimes is very sketchy. It's not as organized as it needs to be, and therefore it makes the nurses and the staff feel that they're not organized. The training is poorly structured. Again, most nurses and medical professionals, I think in general, feel more confident if they have a structured training environment and they know what they're doing. There's nothing worse than going out into a home and seeing a patient that you've never seen before in a home. You've only seen hospital patients, and sometimes it can be somewhat shocking when you walk into a home and see patients that maybe are more sick than you thought they would be, and not knowing exactly what to do, not having adequate supplies, maybe not having the adequate equipment. So it's important that we have the staff members trained so that they can adequately take care of the patients when they actually do get there. The workload they're saying is equivalent to 2 full-time jobs. And I can say that there's times when I know I've talked to a number of nurses where that's exactly how they feel. Of course, a lot of that feeling has to do with on-call responsibilities. It has to do with their documentation that they don't complete when they're in the patient's home, and it needs to be done after hours. So some of that is part of the training and the orientation that's necessary in the agency. So our advice to management, and the staff's advice to management, is to relieve the stress of the field staff. And again, it's that work-life balance issue that we could possibly work with staff better to help them, and possibly look at technology relieving some of that. We're going to talk a little bit about telehealth and how that can relieve some of that stress from the staff. Making sure that they have better training for employees. That seems to be something I hear in particular from almost every staff member that I talk to within an agency. And then documentation requires too much time. Some of that is not anything we can do about. Some of it has to do with Medicare and their requirements. It has to do with things that are changing on an ongoing basis. Who would have thought that PDGM would not be the #1 thing that we were thinking about right now, and we were hit with this virus during the period that we thought we were going to get ready and be in the thick of PDGM. But so the documentation requirements seem to change on an ongoing basis, and that gets a little frustrating, and staff members don't understand that we have several different places that we're looking to be audited by. So We have surveyors we're expecting. We have reviews that are going to be done. We hear that next month the reviews are going to start, the RCDs are going to start. So the documentation requirements and the staff members understanding why the requirements have to be met is helpful in retaining staff, and they're not getting frustrated. So in increasing productivity, we have to realize that nurses aren't computers, and that we have to realize that we're going to have to look at some things to change the way we actually help these staff members increase their productivity. Again, we feel that telehealth is one of the things that'll help. We do believe that Axxess has a solution that's second to none that would help staff members increase their home life and decrease the time that they have to spend on their computers and working with documentation. The next slide, Tammy. I think this is, Tammy, I'm going to turn this over to you. I believe this is where you're going to pick up and talk about the changes to support the technology.
Thank you, Arlene. And I really enjoyed hearing those statistics. I think that we are in a rapidly changing post-acute landscape. And here at Axxess, we are changing rapidly to keep up with the post-acute world and the needs of our clients and customers. Waiver programs. There's a lot of waivers out there now in COVID. Arlene spoke a little bit about those waivers. We don't know how long the waivers are going to last, but we do know that these waivers are affecting the way that home care and hospice agencies can do business, and it's actually helping us improve the way that we can relate to our patients in the home. That increased access to telehealth is huge in Medicare now, especially with our face-to-face visits. We're able to do the telehealth visits for face-to-face. What has not happened, unfortunately, in our home health world is a telehealth visit does not count as a visit towards the LUPA threshold. It's still non-billable, but I can tell you that there's a lot of grassroots effort. There's a lot of lobbying going on in DC now to try to allow us to count those telehealth visits as billable visits. As we look at the graph on this next page, I'll show you just a few of the telehealth waivers that are in place now, and also speaking to the point that we really have to get involved in those efforts to keep pushing our lobbying boards to keep telehealth in place as a billable visit. Currently, it is not a billable visit as far as home health goes. Hospice has a little bit more liberty to use that as a billable visit. So as we look to make changes and actually let our voice be known, I would encourage you to get involved with your state and national organization. Make sure that you are letting your voice be known. All right, so our summary of our telehealth provisions, allowing face-to-face visits. As you can see, home health and hospice both allow face-to-face provisions. Both allow that to occur on initial assessment. And they allow that in hospice for the initial comprehensive nursing assessment. That is not allowed in home care now. Visits on the plan of care, we do have to include those visits on the plan of care. You have to say the frequency of those on your plan of care, and you need software that's going to be able to support you in doing that. Axxess software does support and is completely updated with all telehealth waivers. You can also see that these are subject to expire at any time. And basically, those are subject to expire at the end of the public health epidemic. We don't know when that is, but we know that it is not considered a permanent waiver. It's not been written in as a permanent waiver at this point. Our technology and any technology system you use should promote your nurse retention. Arlene mentioned about the 18-month turnover in home health. She also mentioned a huge amount of money that's associated with that turnover, up to $50,000. So as operators and as nurses out in the field, we want to make sure that we promote nurse retention through ease of use. The best technology out there does not help a nurse if she doesn't use it or doesn't understand how to use it. So having an extremely easy to use technology system is very important. We also need to make sure that that technology streamlines operations. It makes things so, like Arlene mentioned, productivity. It makes it so the nurse can be more productive. Maybe instead of being able to see 5 or 6 patients a day, maybe if operations are streamlined and we keep that nurse in a geographic area, they can see, 6 to 7 patients a day. That's huge. That's a huge improvement as we look at those shrinking numbers. I thought that was fascinating information to look at how fast the projections are for needing new nurses and then how quickly nurses are retiring. When you see 70,000 nurses retiring a year and knowing that we can't keep up with that demand, we really have to look at ways to improve that productivity. So anything that technology can do to streamline those operations. Interoperability is another big key component. We want to be able to document things one time. We want to be able to enter it into an EMR system one time. I remember a few years back, it's been probably closer to 5 or 6 now, when I was transitioning the agency from paper to a point of care technology system. We actually looked at the number of times that a nurse had to enter a patient's name on a start of care. And it was something like 28 times. 28 times to write one person's name. Just think about that and think about how technology, when you enter that one time and how it transposes that information throughout multiple forms. Also receiving information from outside sources. Medication management is the one that pops in my head first and foremost. Being able to review those medications in a central location, being able to have that connection to pharmacy systems. So if there's changes, if there's drug-drug interactions or drug-food interactions, we know that immediately. That's huge. And also being able to communicate that information to physicians. I can't tell you the number of times I've been in the home and you call the doctor and you're trying to reconcile medicines and they tell you to reconcile the medicine as a nurse, which we know is, really a physician's practice and that's within their scope and not ours. But that interoperability so that we can see that with one touch on a screen makes that huge for us and improves our time and it improves our productivity. And basically, it's going to improve the patient's outcomes ultimately. So we want to grow the business through connectivity. We want to pretty much Uberize healthcare. That's a term we use for Axxess Care. That's where we are able to connect professionals to agencies and ultimately to patients. By being able to make those connections, we're able to put agencies in touch with nurses throughout the state and even throughout multiple states. We know that here in Texas, it's a compact state, but under some of the waiver programs, providers can now cross state lines. They're able to go from Texas to Connecticut if they would like to do that. And having this Uberization of healthcare where you can actually look to see nurses that are wanting to pick up additional visits, additional starter cares as an agency allows you to really think outside of the box and maximize the power of technology to promote your patient outcomes and also to promote the growth of your business. So how do we do that? We do that through engaging multiple employees, RNs, LVNs, PTs, and PTAs. We engage them through our platform. They actually fill out a self-competency evaluation. Um, all of these individuals are ran through OIG and background checks. All of their licensures are verified. And then these individuals, once they pass all of our credentialing process, are actually put into the system. They're then able to develop a profile, and they're able to tell you as an agency if they are willing to work in certain zip codes, certain states, if they have certain specialties, perhaps IV skills, maybe they're an expert at management and evaluation of care plan, maybe as a PT, they have excellent skill sets in maintenance therapy. They're able to tell you that, and you're able to see that pretty quickly with a click of a button. They've also been rated as they start doing visits using Axxess Care. They're rated by all the agencies that they're providing supplemental visits for, and it's basically rated on a star system, 1 through 5. 1 star, obviously, you might not want to hire that individual or have that individual do your visits. But if you have 5 stars, 4 and 5 stars, it's kind of like in home care. The 4 and 5 star agencies are the ones that are excellent. They've had excellent rating across the board, no matter what they've done. 3 is kind of the average rating, just like it is in our home health star system for home health compare. This provides you an excellent way not only to supplement your staff, but to also retain the staff you already have. Arlene mentioned some of the reasons that nurses are leaving. Those reasons included basically increased workload and surges. We all know when the surge happens, it happens at 5 o'clock on a Friday afternoon when the hospitals are desperately discharging their patients. They begin discharging patients, and we're set to admit those patients, and we don't have enough staff to do it. So what happens is either your DCS goes out, your Director of Clinical Services, or your administrator goes out, performs visits, and you put some incentives out there for your staff that's already working and maybe doing 2 or 3 admissions to do 1 more admission for you. And nurses, by nature of who we are, we like to help. We're folks that like to help. And so they pick up those visits. But eventually, I remember seeing that on Arlene's slide, fatigue. They get burned out. They just can't do it anymore. So eventually you're going to lose that kind of staff. By having Axxess Care and being able to supplement those visits when they surge, you're able to protect that staff that you currently have in place. That's saving you about $50,000 for every nurse that doesn't turn over. That's a huge cost saving for you as an agency. In addition, you're able to recruit staff. The nurses that you have that come and pick up those extra visits, oftentimes they're looking for their permanent home health home. They're looking for their permanent full-time employment. Those are nurses that you may want to pick up as full-time, when your census allows, and if that's part of your strategic plan. So technology is providing you a multiple scope of opportunities through Axxess Care. Therapy visits. I wanted to highlight this. We have the opportunity of Axxess of having the ability to look at literally thousands of agencies across the United States, Puerto Rico, Guam, and Saudi Arabia. We're able to look at patterns and kind of look to see what people were doing prior to PDGM under the PPS system and what they're doing now. And you can see that if you look at the 1 to 5 visits under PPS, we didn't really do a lot of 1 to 5 visits. And why is that? Well, because we were really incentivized to do more therapy visits. So we were doing less of the 1 to 5 visits and we were doing more of what I would call that sweet spot, that 10 to 13 and 14 to 19 visits. Now with PDGM, you'll notice that that number is going up tremendously. Under PDGM, which is the gray bar, about 70% of therapy visits are going to fall in that 1 to 5 range. We're doing less and less therapy visits. We're using some very creative ways to manage outcomes, including telehealth, including pathways. But we're doing a lot more of 1 to 5 visits. That has caused many of our agencies to actually have to either reduce hours of therapists or maybe not use as many therapists. So now there's a huge need for supplemental staff for physical therapy and occupational therapy. We don't want necessarily all full-time staff. Axxess Care allows you to supplement your therapy staff and meet that strategic goals that through PDGM to reduce those number of visits and still provide quality outcomes. This slide represents kind of the cost benefits of using supplemental staff as a contract. We're very familiar with that with therapy companies. We've been using contract therapy companies pretty much since the inception of home health. That's been a model for us. We're not quite as used to it when we were dealing with RNs. So I wanted to put together just a really good visual of how much money is saved using a contract nurse versus using a full-time employee nurse. So if we look at the average salary in the United States currently for an RN, it's about $78,000, closer to 79. That was as of December 28th, 2018. If we look at the cost of their benefits, and benefits includes a lot, it includes their insurance, it includes workman's comp, it includes time off. Those cost of benefits add about another 31.7% to their salary. So you're not just paying them that 78, you have to add on about 31.7% to that. You would save about $25,000 using someone the same amount of hours under a technology enhanced program like Axxess Care versus using that RN full time. That's a huge cost saving. In addition to that, many of our nurses are starting to look at contract nursing now. And there's a couple of reasons for that. There was a tax law that was passed a couple of years ago that allows small business owners, which includes independent contractors, to have about a 20% pass through on their taxes. What does that mean? That means that if you make $78,000 as a contract employee, the new tax laws allow you to take 20% of that off the top and not pay taxes for it. That was a law that was passed to enhance our small business owners, and it actually includes independent contractors. That law really had nurses thinking, you know, I might rather be a contract employee. I think prior to that point, nurses didn't really catch on to the fact that this is a way they could do business independently. But since that law's been passed, we've been seeing a huge uptick of contract nurses and independent nurse contractors. And we certainly see that in our Axxess Care. We'll show a slide in a moment, and I'll show you actually how many people we have on the platform currently. The breakdown of those benefits for those of you that are thinking, wow, that seems like a lot, breaks down in 6.2% Social Security. You have to pay the employer's half of the Social Security. You pay 1.45% Medicare. 9.65% is paid time off, which includes holidays and vacation time. 9% is insurance, and 5.4% is retirement and savings program, whether that's a matching 401k, whether that's a shared stock. Different companies have different ways of doing their retirement programs. So let's talk a little bit about growth. We're hearing from several of our customers that and clients out there that we're having issues growing during this post pandemic, in which in some states it's still very much still a pandemic. We're having problems growing our footprint. How can we do that? So, what I want to talk about is specialty programs. I think disease management is huge post COVID, during COVID, and especially as we're looking to revamp the Medicare spend rate. Payers want to see results, right? They want to see that costs have been driven down. Nothing does that better than disease management programs. And these programs are geared to chronic disease management. They're geared to specialty programs, and they're geared to drive costs down. So just a couple of examples, IV programs, those are huge. Hospitals want to get patients out of the hospital. They want to send them home with IVs, especially we're even seeing, patients sent home with oxygen and ventilators now during the COVID crisis because there's just not enough beds. So having people trained in those type of skills is huge. With technology that lets you sort through very quickly which nurses has that skill set, you're able to quickly to market an IV therapy program. Also wound therapy. Prior to PDGM, we all shied away from wounds. It was very expensive. Now wound programs actually are the highest paid clinical grouping in all of PDGM. We're starting to see folks that want to really launch a wound therapy program, but they don't have the staff that can do that. It is so easy to connect with that staff through the technology of Axxess Care and actually build out your wound therapy program until you can hire your own full-time wound therapy nurse. Rehab nursing is something with our decrease in therapy cases. Nurses that really have an aptitude to teaching rehab skills, transfers, gait training. That's all within our scope of practice. And Arlene and I both have been nurses long enough that we remember doing everything for the patient. There wasn't a respiratory therapist, very limited physical therapy. So you had to do all those skills. When we really started segregating out the care of the patient and we kind of went to the team concepts, respiratory therapy handled the breathing treatments, they handled the O2 levels, they did all that. We had therapy come in and handle the transfers. So a lot of nurses lost that skill set. With Axxess Care, we can connect you to nurses that have that skill set. They know how to do transfers. They know how to teach transfers. They know how to do a true O2 conservation program under rehab nurses. We can connect you to those nurses so you can build that rehab nursing program. That helps supplement your decrease in your therapy visits and truly helps keep those patients out of the hospital. Coming very soon with Axxess, Arlene is actually going to be teaching a whole session on management and evaluation of care plan. It happens to be my favorite skill set in the home health post-acute world because I see it as a way of maintaining people in their home by managing non-skilled care. You're able to keep people in their home, out of the nursing home, and out of the hospital. That is truly a unique skill set that has to be developed. And we have nurses throughout our states on Axxess Care that know how to do management and evaluation of care plan and know how to do it well and to the point that they know how to document it and how to perform the care in the home. So just a little plug for next month, look for a full series presentation from Arlene on this skill set. Maintenance therapy goes hand in hand with that, but physical therapy actually performs this skill set. It's a way of keeping patients, again, out of the hospital, keeping their outcomes improved, and also a way of maintaining your census by not discharging these patients after 60 days or after 30 days, holding them for longer periods of time so you can maintain their function in the home. In September, Axxess will be hosting a webinar on maintenance therapy. Myself and our physical therapist, Mike Carr, will be presenting this webinar to help agencies really understand how to do maintenance therapy. Along with that is balance programs that kind of goes hand in hand with maintenance therapy, and then a dementia program. Dementia program, and people oftentimes have shied away from that because they've said, oh, we don't do psych nursing, we don't want to get into that. You can do a medical model dementia program that does not have to be ran under the guidelines of psych nursing to control symptoms related to dementia. And we certainly know that that's a huge need, as 1 in 3 people over the age of 65 will develop some form of dementia. So dementia training and dementia management of symptoms is huge. So let's look at Axxess Care in action. And I absolutely love this slide because it really shows the technology that is the foundation of Axxess Care. You can see to the far left, there's a calendar that lets you post visits just by a click of a button. You're able to post a visit and say whether or not you need a IV skilled nurse, whether or not you need a maintenance trained physical therapist, exactly what type of skill set you're looking for, what geographic area it's in, and what you're willing to pay for that visit. We know sometimes we do incentive visits on holidays and weekends. I know a lot of agencies also do these visits when they have a surge, when they have a lot of admissions coming in. They don't want to lose those admissions to their competitors. So they may offer an incentive pay, and we're able to do that very quickly. We're able to put that pay in there. You know, I'll pay $125 for the start of care located in Bandera, Texas. I need an IV trained nurse that's able to do that. That gets posted, and anybody that has the skill set that meets what you're asking for is able to see that post and apply for that visit. So they say, yes, I'll do that visit. Oftentimes you have 2 or 3 nurses applying for the visit. And you can look and review those clinicians and pick which one that you would like to actually go out and do that visit. It's as simple as a click, click, click. You're able to communicate all the information you need to them for that start of care. We encourage you to, if this is someone that you're using for the first time, to also pick up the phone, you know, have a conference with them, talk to them about, you know, what your agency policies are, anything particular that you want to tell that particular nurse, especially those first time visits. A lot of our agencies that are using Axxess Care have a group of clinicians, nurses, and PTs that they use all the time. So even though multiple people are applying, they became very familiar with, you know, Lisa Smith. So every time Lisa Smith applies, they're going to pick her for those visits. It's a really amazing system that allows you to see everything at a glance. And what it ends up doing is actually ends up improving outcomes. It improves your patient outcomes because you're not missing visits. It's going to improve continuity, especially like I said, we have a lot of organizations using the same clinicians over and over again. The technology that they're able to use is basically a bring your own device. They can use their, you know, their iPad, they can use their iPhone, they can use any technology that they would like to. And what that does is that really gives them that ease of use. They're, you're most familiar with your own iPhone, right? So you're able to manipulate that better. You can do complete assessments on your iPhone, on our mobile solutions. So that makes it very easy. It also makes it very easy for these staff to pick up a visit. Maybe they work in the hospital during the day, and they want to pick up a visit in the afternoon after they get off work. They're quickly able to do that because everybody has their iPhones with them all the time, right? The other thing our system has baked in it is it has predictive analytics in it. We're able to do standardized testing that predicts things like patients that may be going to have a fall, patients that may need increased infection control measures. We have multiple COVID measures built into the system. We can actually quickly teach COVID interventions with just a quick click. Disease management, we have patient pathways, patients interventions baked into the system. So if someone has CHF, there's an intervention there for weight. There's an intervention there for how to, take medications. That's all baked in. Risk stratification, able to see very quickly, and we kind of mentioned this with predictive analytics, those patients that we have to watch more closely for potential falls or for potential hospitalization. Our system quickly works off of learned behavior through clinical intelligence. So there's clinical intelligence at every step in the Axxess product. So if we say something on assessment, and I'll say, let's say we said someone had an open wound, and then when we're doing our ICD-10 coding, we don't list a wound anywhere in our ICD-10 coding. Our system's going to pick that up and catch it. Same way if we say that a patient is short of breath. We've documented the patient's short of breath, but yet when we go to do our OASIS, we say that the patient's not short of breath. Our system's going to pick that up very quickly and not allow the nurse to make that error. So what that does is it trains nurses and therapists as they go on learned behavior and best practices. The last thing I want to mention is patient touch points. Truly, telehealth, Arlene mentioned this, telehealth is emerging during the pandemic, and we have that telehealth baked into the system where you can actually schedule telehealth visits. And I like to call them virtual visits because we actually outline interventions that nurse needs to be able to do for that touch point, for that virtual visit. What that does is it makes sure that phone call that the nurse makes, or maybe she's going to use Skype, whatever method, that it has a result at the end of it. It's very goal oriented. Here's an example of one of our dashboards, speaking of analytics, that'll show clinicians quickly. The one I like probably the best is that LUPA risk alert. With PDGM, it's so hard to track move-in a visit because we know that the episodes end or the billing period ends in 30 days. So if I push this visit from a Thursday to a Friday, that may push it into a different billing period, which would push a LUPA. If I did that as a clinician, I would get an alert to tell me very quickly that, oh, wait, you can't push this visit. It also shows me very quickly outcome potential. So if I'm not scoring OASIS correctly, and I have that patient scored that they're just perfect and everything, which would make you wonder why are they on home health to start with. I would have a potential of improvement of 0 out of 6. I couldn't improve any outcomes. But in this particular case, I see that I can improve 6 out of 6 outcomes. In our value-based purchases state, this is huge because we know that you're paid and you're reimbursed based on your ability to show improvement in outcomes. So those are two of the things that I like to highlight on this. There's other things in here that'll show you, home health supervisory visit and also PTA supervisory visit. That's all baked into a very easy to read dashboard. So cost of a single visit, if you're thinking, not sure about this, I'm not sure about all of this. I really don't want to incentivize staff by paying them a little extra to do a visit. If you look at how much a single visit will cost, over $1,100 by missing one visit in the PDGM world. That's a lot of money. So if you can incentivize a nurse to maybe pick up that extra visit, it's going to behoove you to actually make that cost, make that little bit of cost expenditure up front to avoid that loop of visit. That cost of that extra $10 or $15 you may incentivize them is well paid back with the $1,100 savings. Okay, so the value of Axxess care. It's going to increase your revenue two ways. It's going to drive down your LUPA rates. It's also going to drive down your cost of salary versus contract versus non-contract staff. And I think it's also going to grow your footprint. It's going to grow your referral base. It's going to grow your possibly your geographic area because you're able to expand into areas as long as your licensure covers that maybe you haven't been able to do before because you haven't been able to find the staff. So it's definitely going to increase your revenue. It's going to reduce your overhead. We talked about that with the staffing costs and the FTE costs. It's going to streamline your operations because your scheduling and staffing is simply a click of a button. It integrates all of that workflow, and it actually allows you to look at your schedule and decide if you want to post externally to access care through just looking at your schedule system. It's going to ensure compliance. Every step of the way, we build in compliance. So basically, it's like a nurse on the shoulder telling that nurse, telling that PT how to document. I love, and I didn't mention it earlier, the digital HR file. All of this background work that's ran on these supplemental staffers is actually housed in Axxess in an HR file. So those background checks, those OIG checks, those competency evals, those are all kept in an HR file that you can simply get to with a click of a button. It's definitely going to improve your outcomes because you're able to get staff out there more quickly and you're able to get quality staff that matches the patient's needs. And with employees, you're definitely going to improve their retention by less burnout, having supplemental staff that can pick up those surges, and you're going to drive down that turnover rate, which again, ultimately improves your bottom line. So when we look at our snapshot, we see that currently on Axxess Care, there's been 23,000 visits completed. There is over 3,500 clinicians on Axxess at this time, Axxess Care. 1,050 organizations are actually using it throughout 16 states. And I have to say, I'm really proud of how fast we went into other states. Originally, we were at 7 states. We had the COVID crisis hit, and the Axxess Care team, along with Axxess, deployed this technology to additional states. They deployed that quickly because we knew that there were staffing needs throughout the United States with COVID. So now we have made it available. You'll see that in teal, all the states that we're currently covering. And I don't see any questions coming through at this time. I do want to provide myself and Arlene's information. You can certainly email us at our axxess.com email address. If you think of questions afterwards, we will be happy to connect you with Axxess Care staff if you would like a demonstration of this product. If you're currently on Axxess, and even if you're not on Axxess product at the time and you would like that demo, please reach out to us and we'll make sure that we get you in touch with someone to give you a more deeper dive into the solution. I want to thank you for attending. Arlene and I certainly appreciate your time today. And again, reach out to us for any questions. Thank you.
Thank you, Tammy and Arlene, for sharing your wisdom and insights with us today. As a reminder, we'll provide everyone who registered a link to the slides and a video recording via email. Apologies, we didn't have time to answer any questions today, but we'll follow up with anyone who may submit them after the webinar. Thank you for joining us today as we deliver on our mission to empower healthcare organizations and professionals with the world's best technology solutions. Have a great day. Bye-bye.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on software advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.